The rates of obesity amongst our young people have been steadily climbing in the city. On average, about 40% of students in Boston public schools are overweight and obese.
The information and efforts that we put out there must be simple, easy to use, easy to understand, and they have to be relevant and applicable to people's daily lives.
The guidelines really are meant to serve as a guide to what we should be eating in the current environment and to help individuals across all age, ethnicities, and genders on what to eat.
MyPlate provides a very good starting point to help children and families make the best food choices. A low glycemic load diet is prescribed to patients in the Optimal Weight for Life clinic at Children's Hospital Boston.
One of the things that's incredibly important is to get kids interested in flavor and bring different kinds of flavors to the table so that it's not just boring old steamed broccoli.
Obesity is a uniquely complicated problem, and the New Balance Foundation Obesity Prevention Center at Children's aims to be a gathering place for researchers, clinicians, and public health experts so that we could look at the problem of childhood obesity from all of the many perspectives.
Some of the key messages we're talking about that go along with the MyPlate is fill half your plates from fruits and vegetables, make half your grains whole grains, choose sodium numbers that are lower, drink 1% or low-fat milk, drink water instead of sugary beverages. These are the kind of simple messages that, okay, I understand what I can do here if I want to make a change. Little steps that can actually have a really big impact.
MyPlate provides a very important step forward from the food guide pyramids of the 90s and early in this last decade. But it's important to interpret each of the components of MyPlate to ensure the healthiest foods in that category.
Right here with this visual cue and these messages is an opportunity to have a huge impact. I hope that as a community who cares about these issues, we find a way to really come together and not let this go by, because our country simply can't afford to miss this chance.
There aren't one or a few causes of childhood obesity. It's our genes, our diet, our physical activity level, but also family dynamics, social factors, economic influences, even politics, such as the farm subsidies bill, directly or indirectly affects obesity rates in the country. So the New Balance Foundation Obesity Prevention Center aims to create an answer that's greater than any one component of the problem.